Have you ever wondered how scientists figure out health problems that take like decades to show up? Well, today we're going to pull back the curtain on a really clever research trick that combines the speed of a snapshot with the depth of a feature film. It's all about getting us faster answers when we need them the most.
I mean, think about it. Some of the biggest health challenges out there, things like the long-term effects of our environment or what we eat, can take an entire lifetime to really understand. But, public health crises don't exactly wait around. So the big question is, how do we get reliable answers now? That's what we're going to dig into.
All right, here's our game plan. We'll start with two of the classic research methods, the slow and steady gold standard and the super fast snapshot. Then we'll get to the cool part, how to combine them into a powerful hybrid. We'll look at the pros, the cons, and wrap it all up with why this little trick really matters for everyone's health.
Okay, first up, let's talk about what many researchers consider the absolute gold standard. This is the approach you take when you need to see the whole story, from beginning to end with no shortcuts. It's called a cohort study. And honestly, the best way to think about it is like watching a movie, a really, really long movie, about a group of people, sometimes for years or even decades. You're just tracking their habits, their health, everything, to see what actually leads to certain outcomes. It's amazing for figuring out cause and effect, but as you can probably guess, it takes a very long time.
But what if you don't have decades to wait for the movie to end, right? Well, luckily, there's another approach that gives you a crystal clear picture of what's happening right this second.
And that's the cross-sectional study. So if the other one was a long movie, think of this as a single photograph, just one click of the camera. It is fantastic for getting a quick snapshot of a situation, like how many people have a certain condition right now, but it can't tell you what happened before the photo or what's going to happen after.
So you see the trade-off here, right? It's a classic dilemma for researchers. On one side, you've got the cohort study. It gives you the full story, it can prove causality, but man, is it slow and expensive. On the other side, you have the cross-sectional study. It's fast, it's efficient, it gives you a great snapshot, but it can't tell you what caused what.
And this brings us to the heart of our explainer today. Because what if you didn't have to choose? What if you could actually get the best of both worlds?
It really feels like a tough choice, doesn't it? Do you commit to a 10-year study to get rock-solid proof, or do you go for the quick answers that might be, well, a little fuzzy? Well, some really clever researchers figured out that maybe, just maybe, you don't actually have to choose at all.
And here it is. The solution is so elegant. You embed the snapshot inside the movie. You take one of those long-running cohort studies, and along the way, you do these quick cross-sectional analyses. The key here is you're not starting a brand new study, you're just using the data you're already collecting in a much, much smarter way.
And this is a total game changer. It means that while the full movie is still filming, researchers can basically pause and look at individual frames, these little snapshots, to get immediate insights and start answering urgent questions. They get early clues without having to wait for the final credits to roll.
So what's the actual payoff of this hybrid approach? Well, the advantages are huge, and they make research so much smarter and way more effective out in the real world.
The benefits here are just so practical. First, you get timely insights. An urgent health issue pops up, boom, you can check the latest snapshot. These snapshots also let you test out new ideas on the fly. You can zoom in on specific groups, like by age or gender, and spot hidden health disparities. It's also super cost-effective because you're just getting more bang for your buck from data you already have. And finally, these regular check-ins help confirm that the long-term trends you're seeing are actually real.
But of course, no method is perfect. It's not a silver bullet. To really get the most out of this hybrid approach, researchers have to be really aware of a few potential tripwires.
Okay, so there are a few things to watch out for. First, these things called confounding variables. For example, a snapshot might show that coffee drinkers have more heart disease, but is it really the coffee? Or is it that coffee drinkers are also more likely to smoke? See the problem? Then there's survivor bias. The people who stick around for a really long study might just be healthier than the people who dropped out, and that can skew your results. And finally, you've still got that causality problem. A snapshot can tell you two things are linked, but it can't tell you which one is the chicken and which is the egg.
And that's why, as the researchers Sumro and Maman put it, you have to be really cautious when you interpret these results. These snapshots are powerful clues, absolutely, but they're not the final verdict. That's what the rest of the movie, the full cohort study, is for.
So, why did we just spend all this time explaining a research method? Because at the end of the day, better, smarter research leads to better health for every single one of us.
By combining that deep, long-term understanding with the speed of these snapshots, researchers can just be so much more responsive. They can react to new health threats and understand what's going on with public health in a much more complete and dynamic way.
And get this, today we're basically supercharging this whole approach with modern tools. We're talking about machine learning and powerful algorithms that can scan through these data snapshots and find hidden patterns and predictors, connections that a human researcher might completely miss. This combo of a smart method and powerful tech is just incredible.
Ultimately, this is what it all comes down to: producing solid, evidence-based insights that can directly enhance health outcomes and help us close some of those unfair health gaps between different populations. That is the real endgame here.
So this leaves us with one final big thought. With such a powerful and efficient tool in our hands, it really makes you wonder, what's the next big health mystery we should point this thing out? Thanks so much for joining me.